Today's story is about a lady. This is a movie where a lady comes to talk to her doctor when she is pregnant. And all that is being discussed between the two is what is the story of this movie. Now, this lady, as we can see, she is pretty fat. And if we talk about the BMI, then the weighing machine is depicting a lip with a sweet about to enter. Now, this story is about diabetes, so it is very, very natural for the mouth to be full of sweets. Now, what is the significance of this lip with the sweet? The lip denotes the number 3 and the sweet denotes the number 0. So, a BMI of more than 30, this reading moving out of the machine is depicting that it is more than what the machine can measure. So BMI of more than 30 is what is a risk factor for this lady. Risk factor for what? Risk factor for having gestational diabetes. Now, what is gestational diabetes? It is the diabetes which develops in the late second trimester of pregnancy. So, a person, even if the person who is not pregnant, might develop diabetes during pregnancy due to the diabetogenic state of pregnancy, due to the hormonal changes, human placental lactogen, and all of that happening. So, the lady is prone to have gestational diabetes. So, one risk factor for gestational diabetes this lady has when she enters into the room, the BMI, the lip with a sweet moving out of the weighing machine, depicting the BMI of more than 30 is a risk factor for gestational diabetes. With this risk factor with her body, she moves into the doctor's chamber. Now, whenever somebody goes into the doctor's room, the first thing the doctor does is takes a history. And the doctor asks this patient about her problems. The doctor first asks her, "Tell me, what are your problems? Do you have any vascular issues? Do you have any nerve issues? Do you have a history of diabetes? How was your previous pregnancy?" Now, the moment the doctor talks about the previous pregnancy, this girl now remembers that during her previous pregnancy also she had a very, very fat baby. And how fat and how heavy was the baby? If we can, this baby, after the baby was born, was very, very scared of snakes. And now she's thinking about her previous pregnancy where she had these laddus, these sweets. That means she has gestational diabetes mellitus and a baby who was scared of snakes, heavy baby. So this snake is nothing but is depicting the number 45. So a baby weight of 4.5 kg is what we're trying to remember with this diagram of a snake. So 4.5 kg or more was the weight of the baby, and she also had this sweet pregnancy, what we call as gestational diabetes, in the previous pregnancy. Now the doctor asks, "Okay, now you've told me about your pregnancy, you've told me about your problems. What about your family? Does anybody have diabetes in the family?" Now she says, "Yes, I have a family history. My first degree relative, they have diabetes." Again, this is a risk factor for having gestational diabetes. Now the doctor asks her ethnicity and she says, "I am from India." Again, India is a high risk ethnic zone. So this is again a risk factor for gestational diabetes. Now with the weight and the history and the family history and the macrosomic baby born previously and being from India, this lady has entered into the room with a high risk for gestational diabetes even in this pregnancy. And from her face, you can easily make out that she is pretty much aware of this because she was being told about a lot of it during her preconceptional counseling. Now, the doctor is worried and the doctor asks her, is she on treatment for diabetes? Because the doctor wants to know if she's taking certain medications that need to be changed. So, the medical history of diabetes is what the doctor will ask her, and will ask her about what is the treatment that she's taking. Now, after giving all this history, she has entered the mind of the doctor, and the doctor is now thinking, oh my god, she has got so many high risk factors, and she has also got a history of diabetes and family history of diabetes, a macrosomic baby in the past, so much. Now, slowly, doctor will start giving his opinion. Now, the opinion will contain a lot of parts. Firstly, the doctor will tell her about the investigations which need to be done. So, the doctor will ask her that remember Beyonce HbA1c in the last video? So, the doctor will ask her to get her Beyonce HbA1c done because HbA1c levels have to be less than 6.5 for a safe pregnancy. And if it is more than 10, then definitely the doctor will tell her not to get pregnant. So if these were not done in the preconceptional period, doctor will tell her, please do your Beyonce, and doctor will ask her, now if you can see the eyes on Beyonce and the kidney shying away because all the eyes on Beyonce, this signifies that if in the last 3 months the retina and renal checkup was not done, then again now at present we have to get these also checked. Now if we see this man standing with an axe is nothing but, and this is an ultrasound machine. So this man is hanging this ultrasound machine with an axe. What does this signify? 7 is for axe and 9 for this man. So by 7 to 9 weeks, we have to do the dating scan. This is what this hammering man is trying to do with the ultrasound machine, trying to do the dating scan. And suppose the doctor will tell her that in the previous pregnancy, since you had gestational diabetes, I will do your OGTT. This glass full of sugar is nothing but depicting OGTT. So you had this pregnancy previously where there was gestational diabetes, so have to do OGTT even in the first trimester right now at the booking. Otherwise, if there were other risk factors and not this risk factor of previous GDM, I would do this OGTT in 24 to 28 weeks. But this lady has come with a history of GDM. So we will also do an OGTT. And for the rest of the patients, we generally tend to do the monitoring of blood sugar. Otherwise, we can do a fasting, we can tell the lady to do self-monitoring. All that is done in high-risk patients. Now, after telling her about testing her Beyonce and then all eyes on Beyonce, so kidney shying away, that is retina and renal checkup, has to be done if it was not done in the last 3 months. If it was not done, only then we will do it. And the dating scan, this man with an axe depicts 7 to 9. This is 9 and this is 7. So 7 to 9 weeks is the time for the dating scan. And of course, sugar testing is important. Now we see this cutlery book. Why am I mentioning this cutlery book? The lady has seen on the table, on the doctor's table, is a cutlery book. The book is for booking and cutlery 10, depicting this fork and this plate is depicting a cutlery book. So Cutlery book means booking by 10th week should be done by hook or by crook in these patients. So now the doctor is done with his investigations. Lady is done with her history. Now she is asking, okay, doctor, you've told me the tests, I've told you everything I wanted to say. Now you tell me, if I get pregnant, how do I go about it? How am I going to be when I'm pregnant? And the doctor talks to her and tells her, my dear, pregnancy contains three phases. First phase is the antenatal, then we have the intrapartum, and we have the postpartum. Now, during the antenatal phase, the doctor says, when you have the baby in your tummy, please remember you have to visit. See, this girl, she's visiting the hospital. She's seeing from the window, "Oh, I have to visit the hospital." So, you have to visit the hospital every 1 to 2 weeks. Yes, this is very, very important. Every 1 to 2 week, and it is a joint visit. See, joining hands. Who is joining hands? The diabetes person, doctor, and the antenatal care person. So you have to visit us in 1 to 2 weeks. You have to test your blood sugars regularly on time. See, she is testing her blood sugars. Everything has to be maintained properly. So you have to uh, meet the targets which I'll give you, and you have to follow the treatment properly. During your delivery, the baby can have issues, and the mode of delivery can be affected if the baby is very, very big. So there can be issues in the delivery also, and even when you are breastfeeding, that is the postpartum, even then you can have breastfeeding issues and sepsis, and there's so much that you can have, but you might not also have. So these are the possibilities during pregnancy, during delivery, and after delivery. So now this lady wants to know, okay, now you've told me the problems, now tell me the solution. How do I go about it? What is it that I can do so that I don't have all these problems, doctor, that you've told me about the delivery, about the baby, about the breastfeeding, about the sepsis, and all of that? So, very easy, the doctor says, very, very simple. There are few lifestyle changes and there are some medicines. Now, see this man standing below the axe. So this axe is depicting 7 and this man is below the axe. So he's saying if you stay below the axe, then life is good for you. What does that mean? If your blood sugars are less than 7 millimoles per liter, then you can carry on with lifestyle modifications. If that is how it is staying with lifestyle modification. Now, what is lifestyle modification? See, this man is running. So, 30 minutes of walk after your food. This lady, sorry, not man. So, this lady is active. So, 30 minutes walk after having your food and having food with less glycemic index and high fiber and blah blah blah, and so having good lifestyle, having good food, so that you stay below the axe. What is the axe? 7 is the axe. 7 depicting, being depicted by the axe. So if you can stay below 7, wonderful. Otherwise, and we will check your blood sugars in 1 or 2 weeks and see if your blood sugars are going well with lifestyle. Very good. Otherwise, we have to give you medication, we have to give you pills, or we have to give you injections. So, this is all that the doctor is going to tell the patient, and what the patient is going to tell the doctor in the first meeting, the first romantic meet that they have, is the story of the first trimester booking visit of this lady. In the next sequel of the movie, we will discuss about her love story and what all she will do in the second trimester, and in the third sequel we will discuss about the third trimester. So this is all for the first booking visit. The sequel is going to be coming soon.